Hi, my name is Dr. Brett Welch. I will be discussing age-related macular degeneration, including the age affected, the 3 stages of AMD, how DNA plays a role in AMD, how to prevent vision loss, and what treatments are available. There are multiple factors that contribute to macular degeneration, including diet, environment, and genetics. It is the leading cause of vision loss in Americans aged 60 and over and is also known as age-related macular degeneration. Multiple factors contribute to age-related macular degeneration, including diet, environment, and genetics. Age-related macular degeneration is the leading cause of vision loss among Americans 60 and older. It is also known as macular degeneration. People who smoke have a higher risk of developing hypertension, which leads to the shrinking and narrowing of the blood vessels in the choroid, reducing the blood and oxygen flow to the retina. People who are overweight, particularly men, and consume high amounts of cholesterol and saturated fats are at a higher risk of developing AMD. Family history also plays a significant role in AMD. Research shows that AMD is often associated with mutations in complement system proteins, particularly complement factor H, CFH. AMD reduces the ability of factor H to recognize certain glycosaminoglycans, which are carbohydrates containing amino sugars that occur in proteoglycans, hyaluronic acid, or chondroitin sulfate. AMD reduces the ability of CFH to monitor surface membranes in the back of the eye, causing inflammation within the macula. Proteoglycans are found in pork, beef, chicken, lentils, eggs, asparagus, chickpeas, cheese, and cabbage. Chondroitin is present in bone broth. While hyaluronic acid is present in bone broth, leafy greens, soy products, root vegetables, and citrus fruit. Now let's look at the C3 gene, which is responsible for producing the protein complement component 3. This protein is part of a group of proteins that fight bacteria and viruses, cause inflammation, and clear debris from cells and tissues. Changes in the C3 gene increase the risk of AMD. Also, distorted forms of complement factor B have been found in many AMD patients. Complement factor B is a single-chain polypeptide that circulates in the blood. This gene family regulates the immune system. White or Caucasian people are twice as likely to experience vision loss and become legally blind from AMD compared with African Americans or Hispanics. Hispanics are only 0.5% affected by AMD. African Americans have less than 0.5%, while 10% of the white or Caucasian population between 60 and 80 have age-related macular degeneration. The white or Caucasian are at a higher risk of developing choroidal neovascularization and geographic atrophy than the Hispanic and African American populations due to DNA mutation. Studies show that nearly 50% of Hispanic Latino individuals in the United States who have diabetes develop some form of diabetic retinopathy. Glycosaminoglycan found in CFH is greatly affected by diabetes, especially the heparan sulfate component of glomerular basement membranes of the kidneys. Diabetes reduces the ability of factor H to recognize glycosaminoglycan, which can lead to the development of AMD. A 2011 study was conducted at Vanderbilt University Medical Center in Nashville, Tennessee, on age-related macular degeneration. It was reported that most AMD research has focused on Caucasian genetic data and argued that AMD may develop and progress differently in individuals of African American ancestry. The initial evidence indicates that genetic risk factors operate differently in African Americans than in Caucasians. This represents an important advancement in the development and application of predictive risk models. This study group contributed to a deeper understanding of the core mechanisms of the disease, which will support the development of effective treatments to prevent AMD in all populations. There are 2 types of AMD, dry and wet. Approximately 90% have the dry type, and the remaining 10% have the wet type. In wet AMD, abnormal submacular blood vessels proliferate and often leak, producing fluid accumulation that shifts and damages the macula at an accelerated rate. Wet macular degeneration is more severe than dry macular degeneration and can lead to more rapid vision loss. Diagnosis requires a comprehensive dilated eye examination, which allows the clinician to directly evaluate the macula and detect early signs of neovascular changes. Anti-VEGF vascular endothelial growth factor therapy is the primary treatment for wet AMD, targeting and suppressing the growth of abnormal choroidal blood vessels. Dry macular degeneration has 3 stages and can occur in one or both eyes. Early on, the light-sensitive cells such as rods and cones in the macula gradually break down, slowly obscuring central vision in the affected eye. You may have problems recognizing faces and notice that you need more light to do normal tasks than you did before. An early indicator is a straight line appearing wavy. Yellow deposits under the retina, known as drusen, are an early indicator of AMD, usually detected during a routine dilated eye exam. In the intermediate stage, you may begin to notice blurred areas in the center of your vision. In the advanced stage, macular function is lost, resulting in central vision loss that can ultimately lead to blindness. Dry macular degeneration typically affects both eyes, although in some individuals it involves only one eye while the other remains unaffected. Women appear to be at greater risk than men, largely because women tend to live longer. The condition is age-related, occurring most often between ages 60 and 80. There is no treatment for dry AMD right now, but there is some evidence that high doses of vitamin B complex, A, C, E, and the minerals zinc and copper, when taken together, can slow the development of dry AMD. There are products on the market, including those from Bausch & Lomb, that are intended to help manage the symptoms of age-related macular degeneration. A balanced diet, rich in fresh fruit and leafy green vegetables, is recommended to support overall eye health, as these foods provide antioxidants such as vitamin C and E, carotenoids like lutein and zeaxanthin. These essential minerals help reduce oxidative stress in retinal tissues and are associated with a lower risk of age-related macular degeneration in epidemiological studies. To recap, in this lesson, I discussed the different types of age-related macular degeneration, how to distinguish between the three stages of AMD, and how DNA plays a role in AMD. This concludes the lesson on age-related macular degeneration. I hope you enjoyed it. Have a great rest of your day. If you want to test your knowledge, be sure to take the quiz that accompanies this lecture.